Kavanagh for Dubai Live TV, and I'm joined here today by Pulmonologist Dr. Rashid Nadeem. Dr. Nadeem, it's very nice to meet you.
Same here.
So tell me a bit about your speciality.
I'm a pulmonologist, and that is a lung specialist. We basically deal with the respiratory or breathing illnesses.
And what would be a common lung disease here in UAE?
Most common, like any other place, is pneumonia. And people come with pneumonia, but lung cancer is quite common as well.
Is that related to smoking or?
Yes, of course. Smoking is the single leading cause of risk factor for the lung cancer.
Tell me what sort of treatment is available here in the hospital for somebody suffering from pneumonia?
Well, pneumonia cancer basically entails many things. For example, taking care of the infection itself. So we have every antibiotic available in the world is available in Dubai as well. Sometimes they get worse that they end up in intensive care unit and they may need ventilator, artificial breathing machine for them. So we provide ventilation. And sometimes they may need hemodialysis if their kidneys fail. So we have a variety of treatment which may be required even for a patient with simple pneumonia.
Some people think that shisha pipes are less dangerous than smoking cigarettes. What's your thoughts on this?
Well, shisha smoking in a way is less dangerous than cigarettes, but it is not well studied. It is depending upon the particle size. The idea is that most of the shisha is exposing the mouth and throat and upper airway. I believe it's as risky as smoking.
Do you get many asthma patients here?
Yeah, actually asthma and asthmatic bronchitis is our single most leading cause of outpatient population seeing us.
Is there any advice for an asthma patient how best to look after their health?
Most asthma patients basically react to changes in the environment. So change is what is bad for asthma patients. So they have to make some changes so that these exposures are gradual.
Is that allergy related?
Yes, because a number of patients with asthma have some allergy.
There is a sleep clinic here at the American Hospital. What sort of patients do you deal with there and what sort of care do you offer?
Yes, we have a dedicated sleep clinic and we have a state-of-the-art sleep lab. And sleep is interesting in a way that many illnesses are actually showing first time in sleep. Okay. So we can detect these disorders very early, even before they become a problem in an awake life.
Do you deal with many patients with genetic related disorders or diseases?
We have quite a few patients here who have genetic disorders like muscular dystrophies, and they don't have muscles and they cannot breathe, so they are on respirators for years, and in some cases all their life they are on the ventilators, and they are living quite nicely because every mode of therapy is available.
Do you perform surgeries like a...
Well, we don't perform surgeries, but we have what we call endobronchial ultrasound. And this technology helps us detect and diagnose lung cancer, which in like a decade ago require a surgery. So a surgery can be avoided and we save patients from a lot of pain, suffering, and stay in the hospital. This is a new technology and only few places have it.
What advice would you give to the people of Dubai?
Well, one thing that I encourage everybody who come to my clinic is whenever they travel, they should wear a mask. And just practicing this one good habit will keep them from getting worse.
Wow, good advice. Dr. Nadeem, thank you very much.
It was a pleasure.
It was a pleasure.